Hi, my name is Louise Davidson. I'm the lead breast nurse specialist for Mae'r and Bevan, and I'm here today to talk about the importance of breast awareness. Most breast cancers are found by women when they've noticed a difference to their breast. So there is no special way to check your breast or examine it, and you don't need any special training. The important thing is to be breast aware, and it's as easy really as TLC, which is touch, look and check. So by touching the breast on a regular basis is to notice anything that feels different and that is unusual for you. By looking visually at the breast and checking anything that's new or different. And when anything is noted that feels different, looks different, then it needs to be checked out further by making an appointment to see your doctor. So everyone has their own way of checking their breasts, but it's important to do it on a regular basis so that if anything is different, then it's picked up at the earliest possible time. And it's important to remember not to just check the breast, but check into the armpit and also high on the chest wall and into the collarbone itself. There are a few signs and symptoms that are important that if you notice within the breast that needs to be checked out further. And they include a lump, which I think to most people is quite well known, and if they find a lump in their breast they would report it to their GP. But there are other things that are also quite important and signs and symptoms that also need to be checked out. So first of all, any change in the size of the breast, and that would be on either side, in one or both breasts or shape. A change in the skin, in any dimpling, puckering, or change in texture of the skin. Any rash or redness on the skin of the breast or on the nipple areola area. Any inversion of the nipple that is new to you, where the nipple turns in, or the nipple itself points in a slightly different direction. Any nipple discharge, and especially if there was any blood noted in that discharge. Any breast pain, and pain into the armpit, and swelling in the armpit and swelling into the collarbone. So any of those symptoms, signs that have changed within the breast, then you need to make an appointment to see your GP.